Hi, everyone, and welcome back to the Home Care USA Updates podcast produced by Hearts for Home Care. My name is Bliss Pointer, and I'm so excited to bring you your second update for this January 2026. So today we are going to start with the federal updates. Sadly, not such great news out of the federal government this week. Home health care is once again under serious financial pressure at the federal level. MedPAC recently recommended, keyword recommended, a 7% cut to Medicare home health payments. That proposal would further strain an already fragile system. So as you know, last year we were waiting for the home health rule that had like a 9%, I believe, cut that was proposed. That did not fully go through. I think it was closer to a 1%. We got that knocked down, strengthened advocacy. That's a great representation. But now MedPAC, which has trended to do this over the past couple of years, has recommended a 7%. So this is something that we are definitely going to have to keep a close eye on. There's been a lot of meetings with the U.S. Ways and Means Committee to push back on this and share just what providers, caregivers, and families are doing in U.S. communities that is so important for keeping clients and families in their homes. All right, so our call to action, as we like to call it for you guys, is do you have a story that can represent what would happen if you didn't have the care you needed when it comes to Medicare? So if you feel like you could share, what's going to happen if the 7% cut happened to you and then you didn't receive the care you've always received, you reduced hours, or maybe you didn't get it at all, please share your story on the Hearts for Home Care website. We have a great story feature that allows you to take a video. You could just hold your phone up kind of like a TikTok and just share your story, and we can bring that to lawmakers and really show them how home care and hospice can affect people in their communities. Now moving to the state updates, we're going to start with New Jersey. The new governor, the 57th governor of New Jersey, Mikie Sherrill, has become the first Democratic woman to hold office in New Jersey. And that is just something that is very powerful, number one, to hear. But as we talked about, I think on our first ever podcast, the primary focus in New Jersey is meeting with the new governor, seeing where she stands on certain policies, making sure that we educate her on how home health and hospice are affecting our communities and how, her people need that care and how it's saving the state money. So that's what advocates and people in government affairs and lobbying are doing now. Alongside, many organizations are coming together to share this news. So if you're in New Jersey, share that information, share your story so that the new governor can hear just how important home health and hospice is in New Jersey. Moving into Pennsylvania, Pennsylvania is having their 2026 Advocacy Day on March 24th. So that's really exciting. I know we talk about Advocacy Days a lot, but I think it's really important that if you live in Pennsylvania and have the opportunity to go into Harrisburg and attend the lobby day, I think that is something that is just so powerful. It's put on by the Pennsylvania Home Care Association. Just so amazing to see everyone come out for that event. Normally a lot of advocates show up. So I'm excited to see that this year. And of course, the governor's 2027 budget is approaching. A lot of meetings taking place. Everyone's trying to see, can they get in that budget? Can it kind of counteract what we got from the state budget, from the state legislature? So I really look forward to seeing that. And the advocacy has really been pushing in Harrisburg. So congratulations, guys. Moving into Delaware, Hearts for Home Care, along with many others, are working to continue advocacy for sustained investment in home care. So it's time to explain to state leaders how home care and hospice and any thing that's going to keep clients at home and out of hospitals and institutions is going to save the state money. So that's just, you think that'd be a no-brainer, right? Save money. Let's do it. So, that's what we're trying to push, especially in this time where everything is so costly. Everything is so high at the moment. So just continuing to push that to lawmakers is very important. Missouri Governor Mike Coe recently released his 2027 budget, and it's proposed, which keeps Medicaid funding flat despite rising costs driven by inflation. Similar thing that happened in Pennsylvania when the legislature released their budget. We're hoping that that won't happen for their governor's budget, but something that, you're not seeing that inflationary increase. And while a lot of us are like, why not? Everything is so high, as I was just saying, everything is just becoming more of a strain. We need to see that reflected. We need to see policies reflect the struggles that us, hardworking people are going through, and you are going through every single day when you go to the grocery store, when you go to get gas, you're seeing it. So it's very important that when it comes to reimbursement rates and the pay that we're giving our aides and nurses is reflecting what they're having to put forth to get to their clients' homes. Moving into North Carolina, so currently lawmakers are planning to return to Raleigh for their short session on April 24th, which is going to be short and fast from what I'm hearing. We currently still have no budget. That is a number one concern. We need that. So hopefully in this short and fast session, they can get a budget pushed out. But according to my things I've heard, I don't know if that's fully going to happen, but we will keep you guys updated as we get closer to April. We're still pretty far out, so we will see. Most important thing is, as we approach session and we say it's a short and fast session, we still need your stories. If you're an advocate in North Carolina, we still need to hear from you so we can share your story with a lawmaker that might push us over the edge and get us a budget and get Medicaid fully funded, because we do not want to face another situation as we did last fall where we faced proposed cuts and then implemented cuts. And it's thanks to advocacy that we are not still dealing with that right now. But the time's going to come. Spring is almost here, and we need that fully funded. So if you're an advocate in North Carolina and would like to share your story, I please recommend you do as soon as possible. South Carolina has a big week next week. We have our Advocacy Day. If you can't tell, I'm very excited about it. First one of the year is always super fun. Also, Governor McMaster's released his 2026-2027 executive budget, which included a lot of the priorities that the Department of Health and Human Services in South Carolina also put in their proposed budget. So, that's kind of the ask right now. It's, hey, legislators, both of these are very similar. The ask is very similar. Can we see this reflected in the legislative budget? So I look forward to keeping you guys a little bit more updated, especially after next week, where we're going to have a lot of in-person conversation with legislators, and we can get a better idea on where they stand. And I know that I believe the budget was presented to one of the committees in South Carolina a few weeks ago. So it'll be exciting to see, what they thought after hearing it really intricately and all the details. If you ever looked at a legislative budget, it's a lot of detail. So it's a lot of words, as if I'd like to say, and it's really hard to kind of get to the nitty gritty of what's in there. But that's what lawmakers are doing now, and I'm excited to hear what they think. Also, Florida, we are not far from their Advocacy Day. They are right behind South Carolina. So we are excited to see that. Florida's 2026 to 2027 budget proposal included targeted investment in Medicaid and long-term care. They see the value. That's what we want from all of these other states. They see the value in home care and hospice. They see the value of keeping the client at home. So that's what we want to see reflected in other states. Props to Florida for seeming to do that. But of course, as we know in politics, things change really quickly. So we want to see that kind of stand ground. So if you're interested in advocating and continuing to share with legislators the important and cost-saving effects of home care and hospice, join us at Advocacy Day on February 11th in Tallahassee. Our next segment is the national headlines and seeing, outside of our regular states we cover, what's going on. Today, it's a little bit different. I have a long list of states that have a lot of things going on, but it kind of all bleeds into the same thing. So I have California, Texas, New York, and Arizona, and all of them are focusing on workforce sustainability. Sustainability is a hard word. I had to get that out. But they're all kind of focused on that right now. How are we going to sustain our workforce with inflation, with continued pressures, with continued difficulties that everyone's facing, no matter what workforce you're in, but especially our health workforce? So how are we going to keep our home health field full? How are we going to fill the hours that are going unfilled currently? And, a lot of times it has a lot to do with the wages. That's what we need. We need higher wages. We need to be competitive with these hospitals and these nursing homes and other businesses like Amazon that have a lot better pay. We need to be able to compete with them. We also just need to be able to provide, a stable job, something that people really want to go do. Not everybody looks at home health and says, I want to go do that, but it's so rewarding and we need to share that with others. So, in California, they continue facing the workforce shortage with a rising labor costs and wage pressure, as I said. Texas, which is a key state to watch with home health and hospice, is continuing to grow. There's a lot of people moving to Texas. There's a lot of people moving to the South in general. And our workforce currently is not able to handle that. We have a lot more people needing care. We don't have enough aides and nurses to care for them. So continuing to look at that for states like Texas. New York, I believe we talked about last podcast, but continued budget pressure and compliance challenges. They ask a lot, and continuing to be able to keep the workforce up, but still reaching these compliances that they need to reach is difficult. So they're dealing with that in New York, and we probably have a couple other states that are dealing with that as well. And then Arizona has increased attention on it because access to home-based care for seniors and individuals living with complex medical needs are urging lawmakers to invest in services that help prevent unnecessary hospitalizations. So a lot of times if home health is not an option or they aren't able to get on some sort of care, so either Medicaid, Medicare, they're going to end up in the hospital. And that's not what you want. That's expensive for the state. That's expensive for the client. And it's just not healthy for them. They're not going to do as well in a hospital as they would do at home where they're comfortable. That's just something that we try to get through to lawmakers all the time. It's like, where would you rather be? Would you rather be in a hospital, having to be away from your family, especially in times like COVID? Family wasn't allowed to visit with you. It was a tough time. And even now, you may not be able to have your family with you in the hospital or in a nursing home all the time. So, would you rather be uncomfortable, not in your own bed, not in your own, as my grandpa would say, his rocking chair? That's the point. You would rather be at home. You would rather be comfortable. I would, at least. So getting that through to lawmakers, through sharing your story, through showing visuals, talking about people in your family. If you've ever had someone that received home care and just, said, I need to stay at home. I'm comfortable at home. It's typically a success story that they're happier. They're more uplifted. Sometimes, especially in cases where you may be getting habilitation, coming back from a surgery, coming back from a tough injury or an illness, and you need to build your strength back up, you're going to be a lot quicker in doing that when you're staying at home rather than in an institution. So that's just kind of the overview. I know that was a lot and it may not have made sense, but it's just something like we talk about how California and Texas and now Arizona are kind of creating a trend for the rest of the country. That's what we're seeing here. We're seeing a lot of states saying, hey, this is costing us a lot of money. What's a better way to do this? And the better way is home health and hospice at home, staying at home. Key word, staying there. Okay. So the next thing we're going to move into is the segment with the questions. So I haven't received a lot of questions through the podcast, but I did receive just a comment and a discussion with a mother whose son was receiving home health services in her area. And she was just sharing, leading into Advocacy Day, about how she advocates for her son. So, a lot of times her number one worry was she didn't want her son to seem like he wasn't providing any assets to her community. I think the way she described to me, he did some community service. He also was excited to go back to work once he got through. I think he had an injury, and that's why he was receiving in-home care services. But that's just something that I found so powerful. And I wanted to remind you guys that when we go advocate, we're not just going in there to share with legislators that there's individuals in their community that just need help and they're not providing anything, but we need to help them. That's not always the case. Many times individuals receiving home health services are those that still want to get out there and work, or providing other things to their community that are keeping that community running, that are keeping that state alive. And that's something that lawmakers need to remember. And I talked about earlier how home health compared to institutionalization is going to allow you to get better quicker. And that's just something that's providing an asset to your community. That's providing someone who may have had an injury, they can get better quicker, get back to work. And that's going to provide better workforce, less jobs having to be filled, just so many benefits to our communities and these districts that these legislators are coming from. So when you're out there advocating, I want you to just think positively. When you're talking to a legislator, it's always important to share sometimes the sad pieces, the things that are going to pull on the heartstrings. But that doesn't always mean you can't share the positives and the benefits that your family member or child, or even yourself at some time, if you received home health services, the positive things that you bring to the table and why we should continue bringing funding and supporting home health through. It's exactly what it is. It can be a positive, and it should be a positive. So that's just something I wanted to remind you guys. Not so much a question, but just kind of a comment that really struck me this week. And it got me thinking about even how I advocate. How do I go out there and share these stories and teach you guys how to share your story? Talking about the positive. I'm all about the positive. Let's just quote of the week this week. So awesome. All right. Well, that is the end of our podcast this week. I hope you guys got the information you were looking for. I hope you feel inspired to advocate. We have so much going on. This time of year is full of events, full of chances to advocate, full of opportunities to talk to your legislators. So I really hope you feel inspired. You feel like you can bring that positive aspect to your advocacy in the coming months. And if you ever have any questions, want to know how to advocate, want to know, how do I share my story? How do I get in touch with a lawmaker? I encourage you to contact us at Hearts for Home Care Advocacy. So we have an email. If you go to our website, I believe the email can be attached in the comments for the description of this podcast. Please reach out to us. We're happy to support you and provide you opportunities to get out there and meet with your legislators and advocate for yourself and others that you care about. So yeah, I look forward to talking to you guys again in February, and I hope you have an amazing week.